everybody, we're going to talk about blood pressure neuroregulation examples and answers, and this information comes from your course pack, pages 54 and 55. Now, before you sit through these examples and answers, I would encourage you to watch the previous PowerPoint slideshow, the one that discusses feedback loops for baroreceptors and chemoreceptors. Let me walk you through some scenarios first. Let's say that someone's had an adrenaline rush, perhaps, scared by a snake in their house, and an adrenaline rush or an epinephrine rush would cause an increase in blood pressure. Okay, that's something you would already know from having looked at the information in this chapter. So that serves as our stimulus. Now, do you know what type of receptor will pick up on this increase in blood pressure? We've got two that we've talked about, baroreceptors that detect blood pressure changes, and chemoreceptors that detect chemistry changes in the bloodstream. Well, this type would be a baroreceptor. And do you remember where those baroreceptors are located? They're found in the aortic arch and the common carotid arteries. All baroreceptors do is act like tattletales. They carry the information to the control center. So where is the control center housed? That's in the medulla oblongata. Okay, and you may recall the medulla oblongata has what's called a cardiovascular center that is subdivided into two parts. The cardiovascular center has a cardiac center portion that controls heart rate, and it has a vasomotor center that controls blood pressure. Okay, so the control center then receives information from the baroreceptor that blood pressure is too high, and the medulla oblongata activates changes to help lower that blood pressure. So, should we send out messages to activate parasympathetic stimulation, or should we continue activating sympathetic stimulation? Well, let's turn on parasympathetic stimulation. So, the medulla is going to send increased parasympathetic stimulation, and that's going to go to the heart, and that happens to travel along the vagus nerve. So, what happens to the firing rate for the SA node? SA node rate slows down, and so in turn, what happens to heart rate? Heart rate will slow down. Now, keep in mind there is no parasympathetic innervation to our blood vessels, so we can't send messages to our vessels to relax. Instead, we have to simultaneously decrease sympathetic stimulation to our heart and to our vessels. And over time, this will cause the heart rate to slow and the vessels will dilate. And so what happens to blood pressure when vessels dilate? Blood pressure will decrease. Okay, so in the past we've talked about this like taking your foot off the gas pedal and letting your car coast to a complete stop rather than having a braking system that allows for immediate dilation of your blood vessels. So over time, her vessels will dilate and her BP will decrease in addition to her heart rate slowing simultaneously. All right, so here's this information for you if you would like to jot it down. Let's take a look at another example. This time you've got a person who's exercising with increasing carbon dioxide levels. That carbon dioxide information is a flag for me because that is a chemistry change in the bloodstream. Okay, so that's something that's going to kind of send my brain into the chemoreceptor mode. So let's use this. Stimulus here is an increase in CO2. And of course, chemoreceptors are found in a few places. They're found in the common carotid arteries and aortic arch. And there's also some central chemoreceptors found in that medulla oblongata as well. So like I mentioned, these chemoreceptors are tattletales, and they will notify the medulla oblongata. I'm just going to call it the MO here for short. And of course, the medulla turns on a set of changes notifying the effectors that they should help get rid of this excess CO2. So keep in mind the medulla has a cardiovascular center. And what are the two portions of that cardiovascular center? You have a cardiac center and you have a vasomotor center, Which one of these controls heart rate? That's cardiac. And of course, vasomotor center controls blood pressure and vessel diameter. So, if you have too much carbon dioxide, you want to get rid of it as quickly as possible. So the effector here is, of course, sending out increased sympathetic stimulations to both the heart and the vasomotor center, or vasomotor center to your tunica media. That will cause your heart rate to go where? We want to increase heart rate, and we want to squeeze those tunica media of our arteries and arterioles, and that will in turn increase blood pressure. There's a piece of the puzzle here that we have not talked about. If you have excess CO2, your brain will also increase respiration in order to remove it from your bloodstream. So that's tied into this increase in heart rate and blood pressure. All right, so here you may want to pause for a moment and jot down these answers. Okay, so here's another scenario for us. A person who is hemorrhaging internally is losing blood. And if blood is being lost, then we look at an inability to transport adequate oxygen out to their cells and tissues. But it says this person's blood pressure and heart rate appeared within a normal range. So there must be some kind of compensation going on to make everything look okay. So what does hemorrhaging do? Does that affect blood chemistry primarily, or does that affect blood pressure? Well, loss of blood primarily affects blood pressure. That's your stimulus. Now, what kind of receptor picks up on this? Chemoreceptors or baroreceptors? Baroreceptors pick up on this. And of course, the medulla oblongata is your control center here. And because this person is losing blood pressure and blood, the medulla is going to turn on a type of stimulation. Is it sympathetic or parasympathetic? It increases sympathetic stimulation. Okay, and of course our effectors are the heart and the blood vessels. So heart rate will increase thanks to increased epinephrine and norepinephrine. And what happens to the diameter of blood vessels? Vessels constrict. And in doing so, we're going to end up increasing the blood pressure in arteries and arterioles. And that's how blood pressure and heart rate appear within a normal range. Now, if she continues to lose blood, then we may start to see a drop in blood pressure and heart rate after a period of time. All right, and so once again, here's an opportunity to jot down those answers. All right, and another scenario for you. This person was administered too much vasopressin. You may recall that antidiuretic hormone, or ADH, is alternately called vasopressin. And the clues hidden there in that word tell you exactly what this hormone does. It squeezes vessels. Vaso meaning vessel, pressin meaning to squeeze or constrict that vessel. So if a person was administered vasopressin, it caused his blood pressure to increase dramatically. And that's because his vessels were squeezing and he's retaining water at the same time. So due to a stimulus of increased blood pressure, his baroreceptors will notify his medulla oblongata. And the goal here is we want that blood pressure to come back down. So we're going to increase parasympathetic stimulation to the heart, and we're going to decrease sympathetic stimulation to both heart and to blood vessels. And in response, heart rate will slow, and that's because the SA node now receives notification from the vagus nerve, and more acetylcholine is dumped onto the SA node. That causes the heart rate to decrease. We also see an increase, or rather a decrease in sympathetic stimulation to the heart. And the decrease in sympathetic stimulation will mean that there's less epinephrine and norepinephrine available. Likewise, blood vessels will also receive less sympathetic stimulation, meaning that they will begin to dilate, and ultimately we see a decrease in blood pressure as well. All right, one more scenario for us. Looking at this particular example, diabetes mellitus is a disorder of insulin problems. Maybe perhaps this person isn't producing enough. And she's experiencing ketoacidosis, and that's really what's catching my eye, because acidosis here means the pH is too low. Okay, that also tells me something about the hydrogen ions. They're too high in the bloodstream. So that tells me what I need to know right now. The stimulus is decreased pH, or you can simply think of it as an increase in hydrogen ions. Okay, and of course, this is something a chemoreceptor would pick up, and those chemoreceptors are located where? Aortic arch, common carotid arteries, and in the brainstem. Okay, and of course, these chemoreceptors are tattletales. They let that medulla oblongata know that there is a problem with blood chemistry. And since we've got too many hydrogens in our bloodstream, we would like to get rid of them as quickly as possible. So we're going to see an increase in sympathetic stimulation. All right, so what do we tell the heart to do? Heart rate increases. That's due to an increase in the SA nodes rate. And likewise, we squeeze or constrict blood vessels, so blood pressure also will increase, and that's due to vasoconstriction. Now, like I mentioned before, there's a piece of the puzzle here that I have not yet discussed, and the respiratory system chapter will also include the respiration rate will increase, and that all works with the cardiovascular system to help remove extra H+ or hydrogen ions from the bloodstream. Okay, so here's another example for us to take a look at. We have a woman who was administered dobutamine during a stress echocardiogram test because exercise was not an option. This medication mimics the effects of exercise on the heart. And so why might she have been told not to take a beta blocker before her test? So first of all, let's talk about beta blockers. Beta blockers are drugs that block the effects of what? Epinephrine and norepinephrine. Okay, and what do epinephrine and norepinephrine do? It is their job to work for the sympathetic nervous system, and they'll increase heart rate, and of course they do blood pressure too. Okay, so this particular drug that she was given during a stress test would combat with or contradict the beta blocker's job here. So she was told not to take her beta blocker because it would block the effects of epinephrine and norepinephrine. So what do you think this particular drug here, dobutamine, does? It must increase heart rate and blood pressure. Okay, so just a good opportunity for us there to review what a beta blocker is there for. Okay, so alcohol vasodilates vessels and inhibits ADH. That's a lot to think about, so let's stop there. Vasodilates vessels. Well, what impact do you think that has on blood pressure? That decreases blood pressure. And if you inhibit ADH, you stop retaining water. So that means you urinate out all that water. Okay, and after several hours of an alcohol drinking binge, this person has a fast heart rate and increased blood pressure. Well, if they've increased their urination and they've lost a lot of their fluids, they probably became dehydrated. So in order to compensate for this loss in blood pressure, then we expect to have baroreceptors send messages to our medulla oblongata. And of course, that medulla oblongata will increase sympathetic stimulation. And of course, heart rate will increase, and vessels will constrict, and that's how we see an increase in blood pressure. So all of this is a compensation for having lost fluids through excess urination, thanks to the inhibition of antidiuretic hormone. All right, so let's take a look at the answers to page 55. You've already got the first problem there completed for you. You've got the high blood pressure when completed. The second problem there is low blood pressure. Once again, this is actually the ADH issue. So if you had drunk too much and you lost a lot of fluids due to inhibition of ADH, you would see a decrease in blood pressure. And that automatically tells me that we've got this baroreceptor that's going to pick up on that information. And baroreceptors tattletale to the medulla oblongata. Well, in response to decreased blood pressure, the medulla decides that it's time to increase sympathetic stimulation. Okay, and we do that by telling the heart, SA node specifically, to increase its rate. And we also tell blood vessels to constrict. And how does that impact blood pressure? That will increase blood pressure. Okay, so I'll give you a moment to compare your notes to what you have on page 55. Let's talk about high blood pH. Now, that means that we have an alkaline situation. Okay, alkaline can come from, say, vomiting. It can also come from taking too many antacids. And alkaline means the pH is above 7.45. That also tells me that we have too few hydrogen ions. Okay, and so that's our stimulus here, is an alkaline blood pH. Now, since we're talking about blood chemistry, that's going to be a chemoreceptor that picks up on this issue. And you may recall they're found in the common carotid arteries, aortic arch, and there's also chemoreceptors in the brainstem. Well, these chemoreceptors tattletale to the medulla oblongata. It's the control center that makes decisions. And its decision is to decrease sympathetic stimulation and simultaneously increase parasympathetic stimulation. All right, so let's talk about the heart first, because that's one of our effectors here. The heart's SA node is going to receive more acetylcholine, ACH, and that will cause the heart rate to decrease. Okay, and that of course involves that vagus nerve. You may recall that's cranial nerve number 10. And at the same time, blood vessels receive less sympathetic stimulation. Let me remind you again that there is no parasympathetic innervation to those vessels. So vessels dilate, or we say vasodilation, and we expect to see blood pressure decrease. Okay, so over time we expect to see the heart rate and the blood pressure decrease. One piece of the puzzle we have not yet taught you is the tie-in of the respiratory system. Respiration will also slow to help this person retain more hydrogen ions. Let's talk about excess carbon dioxide. That's what this term here, hypercapnia, means. Excess CO2 is specifically too much carbon dioxide. Left in the bloodstream, it can acidify the blood and make it more acidic. We're going to just leave it alone at that and say that stimulus here is excess CO2, which of course is picked up by a chemoreceptor, and the chemoreceptor tattletales to the medulla oblongata. If you check your chart on page 54, in this situation we're going to see an increase in what type of stimulation? Sympathetic stimulation, okay? And likewise a decrease in parasympathetic, but that's less important here. So our two effectors are the heart and the blood vessels. What do you think happens to the SA node for the heart? SA node increases the rate. And what happens to vessel diameter? Well, vessels constrict. We call that vasoconstriction. And of course that has an impact of increasing the blood pressure. And so the faster your heart beats, the higher your blood pressure goes. One more thing to tie in here is we're going to see an increase in respiration, and this person will exhale out more of that excess CO2. By the way, CO2 can be a bad thing for us. It is the primary reason that we breathe, is to get rid of that excess CO2. All right, so last one on this page, hypoxia, is a word that means low oxygen levels in the bloodstream. Of course, that is our stimulus here for this person who's traveling in the mountains. This is the chemoreceptor's job to pick up on this particular blood chemistry change, and the medulla oblongata is going to pick up on that and make a decision. We have two choices: increase sympathetic or decrease sympathetic stimulation. Well, if we need more oxygen, we're going to increase sympathetic stimulation while simultaneously decreasing parasympathetic stimulation. So like I said, this sympathetic stimulation here is the more important of those two. We have two effectors. We have the heart And we have the tunica media of the blood vessel. The heart's SA node is the pacemaker, and so we increase epinephrine and norepinephrine. Okay, and so we see an increase in heart rate. What do you think happens to the blood vessels? Well, they vasoconstrict, and we expect to see an increase in blood pressure. Okay, so again, that helps to circulate the little bit of oxygen this person is getting in the body more quickly. All right, so if you need extra problems, please let me know. These are important to understand as a negative feedback loop, and I'll be happy to supply additional problems if you would need them to work on.